All right, as he does every Tuesday morning, effectively, joining us live this morning from Laos, by the way, is Dr. Isaac Bogoch. I'll say good evening to you then, Dr. Bogoch, infectious diseases specialist at Toronto General Hospital. Hope you're doing well.
Thanks so much, Nick. Happy to chat.
Okay, great. So let's start here. Last week, both the flu and COVID vaccines were available to pretty much all of the general public here in Ontario. One thing I haven't noticed, though, is a lot of ads about the availability or sort of encouraging people to sort of go out and get their shots. But I am curious about what the medical community would really like to see when it comes to, uptake on each or both of those vaccines to get to that level of kind of community protection. I know we talk about the flu vaccine. We need about, 8 or 9 and 10 of us to get that shot in the past.
Yeah, I mean, obviously, the more people, the better, especially among those who are most vulnerable. So we know, for example, extremes of age and medical comorbidities put people at greatest risk for severe infection. So yes, while they are available for everybody, it's especially important for those at greatest risk to get this vaccine. Obviously, that's where the biggest impact is. Obviously, these are good vaccines that can reduce the risk of severe illness. They also take the burden off of an already stretched healthcare system. So, there's not just individual benefits, but there's also community benefits for this as well. I think, not to be overly optimistic or pessimistic, but just being realistic, I think the vaccine uptake will likely mimic what we saw last year. And I think the key things that we should probably still be very concerned about is the lower uptake of COVID vaccines, especially among the older community who are at greatest risk of severe infection, such as hospitalization and death. And we should really be taking steps to lower barriers to vaccination in that cohort because they're at the greatest risk.
Yeah, that is an interesting point indeed. We did see the morbidity data on COVID in that sector of the public. Okay, let's move on to this though. And this is a really curious one we were talking about in our meeting yesterday. Avian flu, making headlines globally, seems to really be spreading quickly, particularly in the US and Europe, but not really in Canada. But for something that, kind of effectively, it can't stop birds from flying across the border, so it's easily spreadable. How is Canada apparently sort of bucking the trends from those other jurisdictions?
Well, some of it's luck, some of it's surveillance, some of it's action, but I think a lot of it's luck. The other thing, too, is in the United States, remember, there's a very large outbreak in cattle herds, dairy cattle. It's in over 400 herds, over 14 states impacted. They were very sluggish to get this under control at the onset of it, and now they're paying the price. And there's just more and more animals impacted. There's been spillover events to humans. I think we're at about over 40 humans infected with this already. That's a gross underestimate because they're not testing significantly. It's a huge problem, and it's going to take a lot of effort to get that under control. Fortunately, in Canada, we do not have infections in dairy cows. We still have, there's been poultry infections in the past, and those are easier to get under control. I mean, they essentially cull the flock. But this dairy cow outbreak in the United States has been persistent, and this is the price you pay for a sluggish response to a very contagious outbreak.
Okay, well, let's cross our fingers and hope the luck continues on this side of the border. Listen, before we let you go, Dr. Bogoch, it is a huge day south of the border. The election is happening. We saw what happened when Donald Trump was president and the pandemic arrived years ago. So what are your thoughts on this day as a medical expert? What goes through your mind?
Everyone's going to have issues that are a high priority for them. Obviously, my bias is healthcare and public health. And, I just hope whoever the candidate is takes those two seriously. We know that in the United States, there's significant room for improvement in both the healthcare system and in public health. And, no country is an island. We know we live in a very globalized and interactive world, and what affects the United States can ultimately impact Canada as well. So whichever candidate wins, I hope they take both of those portfolios very seriously.
Okay, appreciate your insight from Laos, where it is 7:28 in the evening. Dr. Isaac Bogoch, we always appreciate this. We'll talk soon. Take care.